everyone. We begin, though, this morning with the contentious issue of whether to reopen the nation after so much of it has been closed down due to the coronavirus. Some states are starting to relax stay-at-home orders this morning as others brace for the virus to hit its peak. There are nearly 31,000 new cases of the virus in the U.S. That is pushing the total number of cases above 706,000. The death toll is topped 37,000. President Trump says sufficient testing capacity has been built to allow states to reopen, but some public health experts dispute that and say the country is still not ready to track and control the spread of COVID-19. Michael George begins our coverage in hard-hit New York City. Michael, good morning.
Good morning, Jeff. The lights may be on in New York, but businesses are still shut down. The state's been on lockdown for more than a month, and the debate over how and when to reopen the nation comes at a time when this crisis is far from over. From Florida to Texas, a few select parks are reopening or will be reopened soon, but carefully.
We still have to be cognizant of the 6-foot distance between people, the 10 people gathering.
And in Minnesota, golf courses will reopen. But right-wing protesters there weren't impressed. They want the state's Democratic governor to lift all stay-at-home orders.
And I don't feel like any governor can determine who or when we decide we want to go to work.
But as deaths and cases continue to rise, governors in many states are standing up against the pressure to ease their orders.
It's not over. We have a lot more to do.
The last thing we can do is relax.
In Virginia, Governor Ralph Northam reported 600 new cases Friday, an 8% single-day rise.
We're still seeing more cases each day, not fewer. So we are not there yet.
Even in San Francisco, the first city to shut down, and now with the fewest cases and deaths of any major city, the mayor Friday ordered masks to be worn in public for the foreseeable future.
But any type of mask, face covering, a scarf, or something that will cover your nose and your mouth, this will be a requirement.
Her month-long order to stay home still stands, but there's some hope. Needed increased testing is on the way.
Testing is a part, an important part, of a multifaceted way that we are going to control and ultimately end this outbreak.
Some communities will institute widespread testing to include those who don't show symptoms. And in Colorado, nursing homes are being targeted.
We're deploying the Colorado National Guard to conduct testing at 3 of the largest nursing homes in the state to help prevent outbreaks.
It comes as new national nursing home data shows more than 3,600 facilities have coronavirus cases. Almost 38,000 residents and staff have tested positive, and more than 6,500 staff and residents have died. As scientists and government officials seek a positive way out, a promising report from the University of Washington, an effective antibody test, came out Friday. And officials here in New York say mass testing is the only way the state will be able to reopen safely. And now everyone in New York is required to wear a mask in public. Michelle?
Good news out of Washington. Glad to hear it. Michael.